Social media, and more importantly its influencers, are poisoning medicine.
Poisoning medicine? It's a spicy take. I heard you guys like drama. If so, you're gonna wanna stay tuned because there is a massive medical YouTuber beef that is unfolding before our very eyes. What's going on, guys? For those of you who are new here, my name is Kevin Jabal, and today we are reacting to Martin Rutkowski's video on how doctor influencers are ruining medicine. And I wanna thank you guys, my viewers, the MVPs, for sliding into my DMs on Instagram and telling me that I had to react to this video. You guys always know the best, juiciest, spiciest videos for me to react to. So, with that being said, let's dive in.
Social media, and more importantly its influencers, are poisoning medicine.
Poisoning medicine? It's a spicy take. Let's see what he has to say.
The online community of medical YouTubers, and yes, I know I'm part of that community, is failing you. Being a part of YouTube means acknowledging the impact you have on people's opinions and impressions, but that also means being transparent and completely forthright about your qualifications and motivations. I am but one voice in the wilderness, and when I see who I'm surrounded by out here, it's honestly disappointing. I began looking at some of the biggest names and most popular doctors on YouTube, and I seriously started wondering, did I miss something? Chiropractors talking about cancer prevention, podiatrists dancing around their living rooms, physician dropouts, giving career tips and discussing fashion hauls? I mean, what the hell is going on here?
Okay, first of all, I don't know what he's got against podiatrists dancing in their living rooms. Dance away. Physician dropouts talking about career advice, Exhibit A. I think there's nothing wrong with that, actually. I think as a physician dropout, you have a very valuable and unique perspective on being inside and outside of medicine, but I digress. I mostly agree with what he's saying here, that there's a lack of transparency with regards to someone's qualifications and what they are and are not qualified to talk about. I can think of more examples on TikTok where you have providers who are not MDs or DOs, but let's just say they're a middle level of provider that go around calling themselves doctor this, doctor that, and act as if they are qualified to talk as physicians. He's also given the cancer example. So definitely a big problem, and a lot of the public doesn't know the difference between an MD versus a DO versus some of these other health professionals. So yeah, I think that people are definitely abusing that and misleading others.
If the biggest personalities are more interested in self-promotion, discussing areas they are not qualified to discuss, and equating slick production and large audience size with expertise and self-importance, then we have a major problem here. It is completely fine to be an entertainer, and you all know that some of my videos are meant to be lighthearted consumption. But if you're going to call yourself a doctor on YouTube and use that to promote credibility, then for God's sake, be credible. If you're not qualified or educated in an area that you're discussing, then quit the pretension and stick to what you know. Or make it abundantly clear that what you're saying is opinion and not fact. The clown show has to stop.
Good point here about speaking to what is opinion versus fact. I take transparency very seriously. Once I left residency, I was very quick to make a video about my decision to leave. There are other creators who took a couple years to be open about their decision of leaving medicine. A lot of people never actually are public about their decision to leave residency at all. But this is not really about residency, right? This is about just transparency and stuff in general and what's opinion and what's fact. I think this is very important. That's one of the reasons why Why I Didn't, which is a series on this channel where I tell you why I did not pursue a particular specialty. I talk about how it's like my very subjective biased opinion and I'm not an attending in that specialty and take everything I say with a massive boulder of salt, and that I even joke that the series is mostly useless at the beginning of every video because what you have to remember is that the viewers don't necessarily know all the nuances and differences between different medical training paths and even the stages of training within a single path. NP versus PA versus MD versus DO, what's undergrad like, what's grad school like, is there residency, is there not? It gets really confusing, even for people in medicine, so you can't really expect the public at large to really keep track of everything. And that's on us as creators to be very transparent as to where we stand with our qualifications.
My professional and personal obligations as a husband and father leave me almost no time, but I've chosen to make time because of the frightening lack of objective information on the internet about neurosurgery and medicine in general.
He and I must be living in two different worlds because I am always amazed and impressed by the quality of content out there with regards to medicine and even neurosurgery from a lot of my colleagues who are content creators. I'm not sure if that's like negativity bias, focusing on the bad ones, but there's a lot of good content out there on the reality of medicine, a lot of really good content. And don't let the bad apple spoil the bunch.
But when influencers use their supposed credibility as medical professionals to give investing or real estate advice, focus only on TikTok reactions, promote wellness activities or products, and spend more time talking about what things are like rather than actually showing you, I start to question the validity and value of their information.
Okay, several problems with this. Number one is that medical professionals, physicians, MDs and DOs in particular, are known for being terrible with their money due to a massive lack of financial education. They don't even understand financial basics. This is why you see so many doctors living paycheck to paycheck, why blogs like the White Coat Investor have really taken off to address that massive gap, that massive need that physicians have. I think it's incredibly valuable for medical creators to be speaking about financial advice or financial literacy or real estate investing. I don't know about TikTok reactions. I don't really watch that many TikTok reactions. But, and when it comes to promoting wellness activities or products or whatever, I would much rather trust a medical professional's opinion of new products and what may or may not be valuable versus just some random Joe Schmo. Now, it obviously depends on how they are pushing it, but yeah, like I don't expect physicians to be one-dimensional and only talk about their career as a neurosurgeon or whatever.
I personally follow creators whose sole purpose is to entertain and those whose sole purpose is to educate.
Okay, false dichotomy. You don't entertain, educate. The most effective educators are able to incorporate a lot of entertainment value in the videos. Look at someone like Rohin Francis from Midlife Crisis. Extremely entertaining and extremely educational at the same time, right? Don't create a false dichotomy here.
Is the doctor you're watching actually qualified to gain your trust? Are they worthy of your time? They deserve the chance to influence you? What have they actually accomplished?
So halfway through the video, the tone is very gatekeepy, and I think this is a little bit more reminiscent of the older generations in medicine. We'll talk more about that shortly, actually. Let's keep watching.
If you're on YouTube as a medical student or resident influencer, congratulations on your success. But please don't lecture me on what it's like to be a doctor. Your day-to-day life in no way resembles what your actual career would look like. And that's no fault of your own. You're still students and trainees. An incomplete product.
If you are a medical student or a resident and you're on YouTube, you have a lot of valuable insight to provide the community because your reality at that stage in training, only you can give that current perspective. Once you graduate to the next level, your perspective of the past is now tainted. Ask any medical student and ask them what pre-med is like. Every single one is gonna be like,
pre-med was easy, med school is hard.
Ask any resident what residency is like compared to med school. Med school was easy, residency is hard. So we have this bias when we look back. If you don't explain to people what you're experiencing in that moment, then when you recount it in the future, it's gonna be a totally different story you're telling, and that's just human nature. But the other thing too is that when you are a trainee, right, you're spending most of your 20s, depending on the specialty, sometimes even into your 30s in training. That's a very important part of your life, and to just kind of skip that and not make content for the hopeful pre-meds out there is doing them a disservice. So please, again, medical student and resident content creators, please do keep making the content that you're making because you have a very valuable perspective to offer.
I'm still learning and growing now as a faculty member and will be for the rest of my life. Lifelong humility is the key to realizing your full potential. So how about a little humility when discussing your opinions and experiences on—
Dude, every time he says humility, I just can't. I just can't.
Not just a loud and self-important voice. And it is blood, sweat, and tears that come from real experience that leads to real credibility. If you're a doctor on YouTube who dropped out and no longer practices or is seriously cut back,
that's me.
I hope the decision was right for you. We all deserve to be happy. But pretending to carry the clout and wisdom of a fully practicing physician is disingenuous.
Okay, so I'm not quite sure here what he means about pretending to carry the clout and wisdom of a fully practicing physician. Obviously, people that don't practice as attending physicians, like myself, should not be going around acting like they are practicing, as attending physicians and speaking about their clinical experience as if they used to, which I definitely don't, and I'm not sure if others do, but At the same time, to give you guys a little bit more context, if you specialize with your specialty, your 4th year of med school is the time in your medical training when you have the broadest knowledge. So as you continue down, let's say neurosurgery, in your residency and your fellowship, you're gonna get more and more narrowly focused, but you're gonna forget everything about diabetes from 4th year of med school, right? If you go into primary care, family medicine, IM, etc., then you retain a lot of that. But that is something to keep in mind with regards to levels of expertise. I think it's kind of this like circle jerk about like,
If you're on this stage of training versus that stage of training, you know this versus that.
and it's like, you kind of need to understand where people's perspective, expertise, and focus is. There are a lot of very prominent physicians who did not finish residency. One of my favorites is Peter Attia, who dropped out of his general surgery residency at Johns Hopkins. But even though he didn't finish residency, I definitely trust him more than a board certified, whoever completed whatever residency, when it comes to things like longevity medicine, because that's what his obsession is. That's his area of practice, his area of focus, right? So there needs to be a little bit like nuance and nuanced understanding here. God, I always use that word nuanced, but this whole like gatekeeping is just not helpful.
I didn't want to become like my mentors because they talked about neurosurgery well. Their patients improved, their research moved the needle, and they genuinely gave their all to their careers. They weren't talking to me about real estate, how to find more ways to take time off, work-life balance, the benefits of passive income, building a business, or selling a service. And while there's nothing wrong with any of that per se, it makes me question your motivation.
Dude, this is like, this is almost like a caricature of the old school perspective in medicine. Back in the old days, and this is actually still somewhat prominent, maybe not prominent, but slightly more common in surgical specialties such as neurosurgery. It was very much about medicine is your life. You didn't have a life outside of it. And the reason they were called residents is because you essentially lived in the hospital, right? So way back in the day, decades ago, surgical residency programs would take pride in having a near 100% divorce rate amongst their surgical residents, just to show how dedicated they were to X surgical specialty, which is nonsense, right? And this idea that talking about work-life balance or benefits of passive income or building a business or selling a service, that these are bad things is backwards, because we have epidemic levels of burnout, depression, and suicide amongst medical trainees. And if you think that the answer is to work harder and dedicate yourself more and harder to medicine, then you're delusional. And you're actually harming medical trainees by even suggesting such nonsense. What it comes down to is when you have an incredibly imbalanced system and you have the pressures, and we're not gonna talk about the whole pressures systemically that are worsening the burnout and depression epidemic amongst medical trainees, but the answer is not to dedicate yourself and work harder in medicine. The answer is you wanna have optionality, you wanna have freedom. If I have, let's say I was a practicing anesthesiologist, if I had the ability to walk away from anesthesiology, then that's actually a better position to be in, because then I can choose to practice as an anesthesiologist because I want to, not because I need to, not because I have to put food on the table, but because I have my scrub business or because I have whatever other side hustles that are allowing me to live financially free, and I'm choosing into the profession. That's a much more powerful place to come from. God, I'm actually surprised by how damaging some of these perspectives and these views are, and I hope a lot of you guys who did watch this video aren't taking this seriously, because this is very toxic for medical trainees. My God.
Do you really care about your supposed profession? Or are you realizing that what you really want is to succeed outside of medicine?
Okay, false dichotomy again. To succeed in medicine, you first need to put on your own oxygen mask. If you are not optimizing your own sleep, your own nutrition, your own exercise, your own self-care, your emotional well-being, how are you gonna kill it as a neurosurgeon, as an anesthesiologist? You're not.
If that's being true to yourself, then again, congratulations. But remember that success in medicine is what gave you the financial stability and security to consider other options in the first place.
Yeah, but just because medicine gave you those options doesn't mean that you owe something to medicine, right? You still want to be real. You want to talk about the pros and the cons to medicine. Actually, one thing that I'm very proud of is that from the beginning, I had a burning desire to create these YouTube videos to teach people what I felt they weren't being taught. It started with study strategies, but then it evolved into additional things. Like, I remember pre-pandemic, it was all these highlight reels about how amazing medicine is. Instagram models looking super cool, super fly with their super white, clean, white coats, freshly ironed, just like,
Loving life, being a doctor is great.
And in the meanwhile, you know, I know for myself and my colleagues, it's like our med school classmates, our co-residents, they're burned out. Like a lot of them had committed suicide. Like it was dark. And I felt like there was a lot of dishonesty hyping up medicine to make it seem like something it really was not. So now I think post-pandemic, it's kind of swung the opposite way where people are a little bit too negative about medicine. But just because medicine helped you get to this place in your life doesn't mean that you owe anything to it. Like you gotta keep it real, and keep it real, especially to the future generation, so the future generation knows what they're getting themselves into. Why do you have so many people who are disillusioned with medicine? Part of the reason is there is that separation between reality and expectation, because what people think medicine is very different from the reality. And thankfully, we have a lot of content creators, myself included, but also a lot of my awesome colleagues on the platform who create content showing you what the reality is for being a physician.
I want the public at large to believe that the fierce competition and intensive training shaping pre-meds into medical students, residents, and attending physicians is creating the most competent and accomplished physicians.
Okay, this is a textbook example of the old school way of thinking, where it was, hey, I worked 120 hours in the hospital and I worked so hard and blah, 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 and therefore you need to do the same thing to become the best surgeon you can be. Nonsense. And we have enough evidence to talk about things like learning while sleep deprived and memory consolidation. We have things like medical error rates with sleep deprivation. And we know that the medical training process is broken. And this kind of way of thinking where, oh, you have to work super hard and be super fierce and competitive. I think competition is good. I'm actually not against competition. What I am particularly against, however, is the broken medical training system, which treats medical trainees as cheap labor rather than as future physicians whose learning needs to be maximized. And if it was more about maximizing their learning, then residency will look very different. Medical school would also look very different during the 3rd and 4th year. Instead, it's treated more as cheap labor. And there's a lot of reasons for that, but doing scout work, working 100-hour weeks is not making you a better surgeon. If you work 60 hours instead and you focus on just things that you need to be doing as a future surgeon rather than scout work, rather than other nonsense, then everyone wins. Patients win, the medical trainee wins, everyone wins.
From watching YouTube, you'd think every doctor is obsessed with work-life balance, maximizing revenue streams and side hustles, retiring early and avoiding too much stress.
There's nothing wrong with any of those things though. And again, it seems like he has a big issue with that. Work-life balance is actually mission critical to be the best physician you can be, simply put. Minimizing stress, also not a bad thing. With the stress performance curve, you know, Yerkes Dodson law, you want to actually have a certain level of stress to maximize performance. The issue is that most of us in modern society get too far to the point where performance starts decreasing. So no problem with trying to reduce stress. And retiring early, again, being in a position of financial independence where you can choose into your job as a physician, I think is a great position to be in. And it's not something that should be shamed.
Or maybe you'd think that getting into medicine is a great way to grow a business, build an online audience, or gain sponsorship deals. Or that medicine is a secondary interest and just a means to other ends. Honestly, I'm sick of it. I love what I do. I love that it's hard. I love that it's a challenge. And I love that it gives me the authority to speak out on neurosurgery as a whole and open my world up to you, my audience.
I think it's great that Martin loves his work. You know, there's two types of people in the world. There's the people who live to work and the people that work to live. And clearly he's about neurosurgery day in and day out, and that's awesome for him. And if that's the case for you too, more power to you. But obviously, a lot of people in medicine are not like that, and they shouldn't be shamed or be thought of as less than because they're not like that. And I think this whole gatekeeping nonsense is pretty silly, kind of damaging, and comes across as very ego-driven more than anything else. For those future doctors out there who are watching, realize that just because you don't want to dedicate your entire life and give up all your hobbies just for the medical profession, that doesn't mean you're gonna be a worse doctor. You can be an amazing doctor and have a balanced life and want to retire early and only work 40 hours a week and whatever. Dedicating your entire life and burning out in the process just to be like, yeah, I did it and I cared so much and I'm so great, and don't do that. It's a losing proposition. You lose, the patients lose. It's a silly game. Anyways, that is it for this video, my friends. Thank you to Martin for creating that original video on doctor influencers, because it got me going and gave me an opportunity to share my unfiltered thoughts as well. So much love, my friends, and I'll see you guys in that next one.